I will ask him to put up the polling questions to start, and we'll get started. Hope everyone had a happy new year and is getting their year started out well and safe. Please do take a moment to complete the polling questions. We utilize these to make sure we're providing adequate and informative education for you guys that you can hopefully bring back to your flex programs and do something with. Today we have Tori Leach from the federal office, as well as Benjamin White to help us understand the carryover process. And hopefully we have a few flex programs here willing to discuss their experiences with carryover, suggestions, tips, and just their experience with it, if nothing else. Understanding that it's an issue that everyone has, or most have this year, and yeah, everyone can benefit from hearing about this. So I'll encourage you guys to take a moment to complete the polls. Short of that, I will let Tori get us started.
Thanks so much, Caleb. Hi, everyone. I am Victoria Leach. I am your Flex Program Coordinator. I am joined today by your lead grants management specialist, Benjamin White, who will also be helping me answer all of your questions as it pertains to the FY 2019 FFR and carryover process. Okay, so things that we're going to go over today, I'll go over the timeline for when things are due. We're going to go over the annual federal financial report, the FFR. I'll go into detail on the steps to take for the carryover process, and I'll also be providing an example of what I expect to see in your carryover submissions. And then we'll take any questions and hope to provide you some clarifying answers. So the timeline for the FFR, your FFR is due on January 30th. This is the annual submission of the annual federal financial report. And then on March 1st is the very last day to submit a prior approval for the carryover request. Now, the timeline should be within 30 days of submission of the FFR that you submit the prior approval request. The recommendation from our grant specialist is that you submit it the day after your FFR is submitted. So the annual federal financial report is a yearly submission which accounts for all of the spending that happened in the previous budget year of FY 2019. As of October 1st of 2020, there has been some changes to the FFR submission, including how you should submit. Please follow the link provided on the screen for details on how to submit the FFR. The FRA is the financial reporting administrator, and that is the person who is registered as the business official on your grant to submit the FFR with an EHB. Please note that in the FFR remarks section, you should indicate whether or not you intend to carry over any unobligated funds. If you need an extension in your FFR, you need to conduct that through an email to your grants management specialist. That individual is listed on your notice of award. So the carryover process. The first step to the carryover process is that you submit and complete the FFR and confirm that you have an unobligated balance in your flex program. The FFR must be completed before you submit a carryover request in EHB. Your grants management specialist will review the FFR and reconcile that with the payment management system. Your third step should be to contact your project officer and discuss your plan to fund the carryover. The fourth step is to prepare the prior approval request in EHB, and the prior approval type is carryover of unobligated balance. You must include the following documents: a signed cover letter addressed to your project officer that indicates the reason why funds were unspent and how the carryover will be used to complete the previously approved goals and objectives. It must also include a budget justification specifically on how carryover funds will be used and an SF 424A budget line item for the carryover amount. Your project officer will then review your carryover request once submitted in EHB and recommend an approval or disapproval or ask you to make changes. If the prior approval request is returned, you will have 2 weeks to make changes. And if changes are not met by that timely deadline, we will disapprove it. Your grants management specialist will prepare a notice of award, approving or disapproving your carryover, and carryover funds will be available as soon as you receive that notice of award. Please note the following items. Have you discussed your plans with your project officer before submitting a request in EHB? Do the proposed activities fit into the goals and objectives of the most recent work plan in the funding year 2019 to 2020? Have you explained how the planned activities align with the work plan? And have you referred to the appropriate sections? The carryover must be within the scope of the original award year, which we have defined as aligned in the work plan of that year. Otherwise, you will need to request an approval of a change of scope. This means that your carryover has to refer to the last year's work plan, while your current projects are linked to this year's work plan. Other things to consider: what work last year has not been done to leave over these unspent funds? For future large unobligated balance, do you have a plan of correction to avoid the problem in the future? Is there an SF424A in the budget line items to get additional funds? Is the budget justification clear with the same level of detail as your grant application? Note that you will need to include activities funded by carryover in your PIMS report for next fall. This carryover funding may be a part of last year's work plan, but it should reflect your report in PIMS for everything that was carried out within this year. Now I'm going to show you an example of what the carryover should look like. Okay, so this is an example of what I should expect to see in a carryover request. As the cover letter should include the title of your project officer and should be addressed to your project officer. You should include the name of your program, the grant number associated with it, the project period, and the budget period for which there is an obligated balance. You should fully describe how much the total unobligated balance is and how much you wish to carry forward into your next year. You should define here the reasons for your unobligated balance. Examples could be underperformance of a contract, under expenditure of a specific contract. Travel, I know, will probably be a big one for UOB this year. Then please describe how you would like to spend your unobligated balance as a carry forward into this year's work plan. You need to specifically describe which objective you will be putting the money towards and describe the work. Please have this signed and on official letterhead. The second document, which I expect to see, is the budget justification. Please list out specifically your program information and include a budget similar to this one with your approved award for FY20, the requested carryover amount, and the total revised award. Then please detail exactly from these specific budget lines where your unobligated balance is going, with a quick description, like so. Now I'll pause for any questions.
Tori, there are no questions in the chat box so far.
Thank you, Laura.
As you'll see, Andy put links to both the slides as well as that attachment that Tori is sharing. You can download those there. Please do take a moment to unmute your microphones and let us know if you have any questions, or type them into the chat box.
So I did receive a couple of questions previous to this presentation. The first question was around flexibilities around addressing COVID-19 within the FLEX program. Currently, there is no active executive order that would issue any additional flexibilities in spending your grant funds towards COVID efforts. However, your project officer is very open to discussing how you may utilize funding for the FLEX program to address COVID-19 that would fit within the current FLEX program structure. The second question that we received was around general flexibilities. We are going to be very flexible with how you would like to spend your flex dollars moving forward. We understand that there will be additional adjustments that need to be made due to the fact that there will be probably very limited travel happening in this program year. So we recommend that you reach out to your project officer very quickly to address any potential unobligated balance for future program years in the event that we will not have any travel or be participating in activities that you had originally budgeted for. I'll again open it up to any questions. If there are no questions, I open it to Benjamin to see if he has any additional comments to share.
Thanks, Tori. I'm going to continue on with, first I want to emphasize some things on as far as the carryover, and I'll just keep going until a question come about. But first thing I just wanted to point out is that the most errors that we get is with the FFR submission is the IDC, the indirect cost rate. For some reason, I'm pretty sure all our recipients know they've been with this program for a while. If we do have new recipients, but the maximum is 15%. IDC, 15% of your total grant is what need to be reported on your FFR. So I know sometimes it's computated, the computation is used based on the fringe benefits and the actual salary, but that is fine, but it's still the percentage rate need to be no more than 15% on the FFR. So that's 15% of your total grant, just to, and you can always refer back to your notice of funding opportunity because it always lists in there what's the maximum IDC that you can use. Also, another thing to bring your attention is the extensions. Usually working with your grant management specialist, we're likely to approve your request for extension as long as you submit it as soon as you know, and we try to work with you to make sure that you have time to submit, but please allow yourself enough time because we have received extensions that recipients want to extend it for 2 days. That's not, and it's on a Friday. So it's not really realistic, so give yourself enough time. At least by submitting a request to extend, we already have you in the system, so you're not going to be penalized for being late as long as we have some kind of communication going, but it still doesn't negate the fact that you have a deadline to submit. So please work with your GMS that's on your notice of award when submitting a request for extension. Did we just get a question
in? We did. We had a question about whether or not this type of training is also available for the financial staff that work in Tricia, what's PMS, Performance Management Systems?
I think Tricia may be referring to the payment management system. Ben, you may know if the business officials have received any training on the new FFR process or not. Yes,
our compliance team went out with training last year. On the new FFR that took effect. The new FFR procedure took effect 1 October. The training was back in June and July. I know it was continued training that went out in September, but you can always reach out to your grants management specialist and we can forward your link for the additional training as well, which is on the PMS website. The PMS website, just to clear up some confusion with that is that we both, PMS and HRSA falls, or PSC/PMS system and HRSA/EHB, both falls under HHS, but we're totally separate as far as departments. So we just want to make sure that that we cannot direct PMS on what they need to do, but we can work with you to help resolve any issues with your FFR if it's submitted through PMS, as long as you're working with the PMS liaison, account liaison, and also the PMS help desk. That's the best first step to take when you're having any issues with the FFR, because they totally takes on that task. And if you're not getting anywhere, then please reach out to your GMS and / your program officer. We try to keep everyone in the loop.
Hey, Ben, this is Kyle from Wyoming. I have a question about the indirects. I have an email from our fiscal office that says for state fiscal year 2021, we estimate the actual percentage of indirect costs will be at 21.5%. You should calculate indirect costs at 21.5%. Is that?
Okay, the indirect costs, you can do your computation on 21. I mean, if that's, just keep in mind the 15% applies to the total grant amount. So it does not apply to each individual category, budget category. It applies directly to the total amount. So as long as it does not exceed that 15%, you can still do your computation, come out with whatever, 6%, 8%, but recently we had a recipient that had a high percentage. It was 50, I'm trying to think what it was, like 53%, so maybe it wasn't, I deal with multiple grants, so maybe it wasn't a flex grant, but it was another grant that had 15% maximum IDC. So they were reporting 53%, but they were going off in their agreement and computing the actual fringe benefits and the salary. So I don't know if to answer your question.
Yeah, that clarified it for me. Yeah, I understand the difference between the 15% for the total and the 21.5% for the indirect, and
Right.
whatever it is, it has to be less than or equal to the 15%.
Right. We get it red flagged when it's actually higher than 15% on the actual FFR. So that's, something to keep in. And it's not going to flag it when you put it into PMS. It only get flagged when it comes over to HRSA from EHB.
Sorry, just to follow up on this. So that means in the rate section itself, you have to put whatever the actual rate is. So they calculate it, say at 30% or 20% or whatever, based on salary and fringe. It would be under the 15%, but then they have to recalculate that, whatever they come up with there, back against the total grant, put in the actual percentage rate.
Yes, what you do is that Daniel?
Scott, but yeah.
Oh, Scott. Oh, that's Scott. How you doing?
Good.
The best thing to do is to do the computation first on the 15% of whatever the total grant amount is. As long as it does not exceed that would be the percentage that you put in as far as the figures you put in on block 11. I don't have the FFR up in front of me.
Yeah, no, I had to pull it up, and it's block 11.
Yeah, block 11. That's what will be reflected as 15% or less. So one or the other, if it has to be 15% or less in those.
So what would you put in block 11? Would you put in the actual rate, or would you just put less than 50, or could you just put in less than 15%?
You will put in, as long as it does not exceed 15%, is what I'm saying. So
okay, but you have to put in what the actual rate against the total grant is in block 11.
No, you can put the actual rate towards the grant. If you want to say if your total rate, as you stated, was like 21, 28%, you can put that in the remarks block. That's fine. But in the actual block 11, it has to be less than 15%.
So you do have to refigure it out so whatever you put in block 11, that rate is under 15%.
Right, because it's not a reject.
Right. No, okay. So it can't say, like in Kyle's case, 21%, even though it's only based off the salary and fringe, because I think block 11, Yeah, they show the base there as, okay, so the one that I'm looking at one that got rejected a couple of years ago, and I just want to make sure I'm clear on it this year.
Right.
The base in this case was just the salary and fringe, and then they put in the rate against that, and they came up with the then they came with the charged amount for the indirect. And even though all of that was under 15%, I guess what you want instead is that the rate be the actual rate and the base be the entire grant then.
Yes, the system, what it reflects is that block that shows, I know it's block 11, but of course it's A, B, C, D.
Right.
That block that shows the rate, it has to be less than 15% of that block. And
Okay.
as far as the figure, as far as what you come up with, as far as the figure, that should be less than 15% of the total grant.
Right. So the base has to be the base should be the total grant, and that's box 11D, and then the rate, and so instead of the base being the salary and fringe, which they put in previously, I think it was.
Right.
Okay, I just want to make sure on that.
Now-
Usually they send it to me before they send it to you, so I can double check that. But I'll make sure that they follow that. So.
And Scott, is you in Hawaii?
Yeah.
Okay, I see them trees back there, the palm trees. And it's okay for them to put information in the remarks. Actually, we ask that you put in the remarks carryover requests, as Tori just stated in her. That's mandatory now. We have to put in there carryover requests, because if we don't have that in there, we may be working on another grant. I work with multiple grants, and we may be looking at the funds as remaining there that you're not going to carry over to pull them funds and use it for something else. So, we just put it all recipients, please put in that, even if you not know exactly how much you're going to carry over, it's helpful to put a figure in there, but if you know exactly how much you're going to carry over, at least put in there that you're planning to carry over your UOB. And also any other remarks like the IDC, this is how we came up with the IDC rate. But as long as that block 11 shows 15% or less, that is what's most important, and the figures are less than 15% of the total grant.
Okay, thank you.
And Tori, we have another question from Kenya Gilkey. Can the carryover be used for new personnel cost, or just used to cover activities under the program areas?
I would say that would require a discussion with the project officer to see if the personnel would be covering activities that were missed in the previous work plan. So it would depend on the scope of work for the new personnel, if it was potentially an increase of that personnel cost. I would have to have more discussion with the project officer on that specific point.
Great. Thanks, guys. Keep your questions coming. Ben, you still have more stuff?
So, good questions, everyone. Another thing is, as Tori mentioned, there is a good lessons learned for everyone is that you don't have to wait to submit your carryover request. The sooner you submit it, the better for the GMS, because we, of course, as I keep stating, that we work with multiple grants. I mean, a ton of grants come in. So if you do your FFR, you may see a FFR get approved, and then we're moving on to the next one, the next one, the next one. So you submit the carryover request 10, 15 days later, we're already past that, and we're moving on to, FFR or TASC 50, and your carryover now is TASC 51. So then it gets, if something else happened, hopefully we don't have another issue with COVID, but if something else happened, we get pulled off and have to work on something else. So just to keep in mind, keeping the communication lines open with your program officer and your GMS, and submitting through EHB. It's best to submit through EHB and get answers than to submit straight through emails all the time, because that's just another system we have to check, but nothing's official in email. Is always what's submitted in EHB that determines. Any other questions?
Not hearing any.
Great. Well, as we are continuing this discussion, please keep in mind you can always pop in questions into the chat box. Just a reminder, here are your contacts for your project officers. Like I mentioned before, your grants management specialist can be found on your notice of award. Also, your project officers should know who your grants management specialists are, so you can always reach out to them. And then here is myself's and Benjamin's contact information, should you have any specific questions. And now I think I'm going to turn it back over to Caleb.
Awesome, thanks. So I'll provide another opportunity to ask Benjamin or Tori any questions specifically about the process, timelines, when, where, whom you want to reach out to, anything like that. Unmute your microphones, or please do utilize the chat box as well. All right. Hearing none, I open it up for a conversation amongst the participants and flex coordinators. I want to hear about how you guys are identifying carryover, identifying ways to address that, stuff like that. I see Jen from Pennsylvania is here. I'd asked her to come and share some of their efforts and experience as well. So Jen, are you there?
Caleb, can you hear me?
I can. Howdy, thank you.
How was everybody? So we definitely are going to have a carryover, and some of the things that we look at, we are working with our hospitals that are in the Pennsylvania Rural Health Model. And what we have found over the time that this has rolled out is that timing has been delayed for various reasons. And of course, we have COVID happening this year. So there are some projects that we work on with some of the hospitals specifically related to their transformation plans within the Pennsylvania Rural Health Model that are delayed. So we know we're going to have carryover from that. We also know we were not able to have the in-person meetings that we had in the past, as well as pretty much a significant limit on travel last year. So, we've already been thinking about what kinds of projects are we going to work on. One of the big things that we did in March, when the hospitals were not able to do elective procedures, we decided to add a project in where we did some coding and billing training through ArchPro Coding. Our hospitals were, most of their staff were underutilized at that point because they couldn't do elective procedures. So we found that was a really good timing in order to have a course like that. So we had really significantly more participation than we would have had normally by offering that. So I think just trying to gauge what our environment is and see what's important to the hospitals now. We ask our hospitals on a regular basis, what are your priorities and what are the things that you're looking to do before we develop our next year's projects. But as everybody knows, you develop these goals and you develop these projects very far in advance. And throughout that year, things could significantly change. COVID's a prime example with that. So as long as it fits into the goals that you had previously, with training or education or you pick a category, whatever category it is, you should be able to, and you have to talk to your project officer about this, but you should be able to work in some additional opportunities to assist your facilities, your RHCs or your hospitals. That's sort of how we handle it.
Awesome, thank you, Jen. Any questions for Jen? All right, I have Marcy from Colorado. Are you on?
I am. Can you hear me?
I can. Howdy. Thanks for joining us.
Yeah, definitely. Thanks for having me. So in Colorado, we do not have a carryover. And, you know, when COVID hit, it hit in our rural resort communities. So it probably impacted about 6 of our critical access hospitals right off the bat. And then our other critical access hospitals were, of course, preparing and planning and putting policies in place for if it were to hit in their communities as well. So they were definitely busy, but we decided to just forge ahead in our programs and in our hosting of our webinars. We continue to host our COG Quality Network webinar and our MBQIP Rapid Cycle Improvement project group webinars. And just to see, you know, we didn't know if people would attend or not. So we hosted them and they attended. And I think for them, it was like a reprieve from their COVID life. It gave them kind of a different focus for an hour. And during those calls, you know, we would ask them how things were going in their communities. We would either start off with that or we would end with it and just open it up for them to share and just, you know, kind of get it out and hear from their peers and just, you know, commiserate a little bit. But the only thing we had to change was our travel. And, you know, being in Colorado, we always try to get out and travel when the weather is good. So we had done travel, you know, September through January. And then when COVID hit kind of in the late February, March is when we needed to make that travel adjustment. So it wasn't a big amount. And we kind of on our regular calls, we also asked, you know, what was a need, and compliance actually came up. So we actually hosted a 2-part webinar series on compliance. So we used some of those travel dollars for that offering. You know, and of course we had other things going on. We usually host our regional QI workshop at a critical access hospital, 4 critical access hospitals around the state. And of course we couldn't do that. So we hosted that virtually. Typically we only have travel for that to incur for that offering. So we didn't have any travel for that. We don't provide food, obviously. So, and the hospitals don't charge us for using their facilities. So we hosted that instead of doing it in person in May, we did it virtually in August. So we were still able to conduct that. And we actually had a good turnout. We instead of getting maybe 1 person from the facilities, we likely got 2 or sometimes 3, or sometimes people were able to come in for a little bit and jump out, you know, if that wasn't their total, if quality wasn't their full role. But they were able to benefit from that. So, you know, it was just, and we continue to do that. Right now, COVID is hitting in other facilities that didn't get impacted really the first time around. And so we're still hosting our webinars and asking what they need. And as long as people are showing up, we're continuing on.
Awesome. Thank you, Marcy. Thank you, Jen. So one example of some shifting and some pivoting into examples related to carryover and that they're happening, and one state that was able to kind of see some of that happening and make a shift quickly and easily. Well, not quickly and easily, but maybe quickly, if not easily. What questions do you guys have for Jen and or Marcy related to that? I think it's interesting, the ability to identify projects or an activity quickly enough to get it, you know, shifted from something that was happening this year to still happening this year, and as well as identifying the need and getting that met quickly. I think that's a really neat thing, Marcy. And I'm sure there are others. If you guys have examples that you've had that might benefit other coordinators, we'd love to hear them. But yeah, I think that's a great example.
Hey, Caleb, it's Kyle from Wyoming. So I kind of would like to hear a little bit more about how people finish the flex year without any carryover. I mean, I don't feel like I have a lot of carryover, but I still have carryover. So what happens if they don't have any?
Yeah, absolutely. Anyone other, Marcy, we've heard from a little bit in the shift of this year, but anyone else who generally doesn't or isn't going to coming forward, we'd love to hear you and just how you manage that, especially this year with the almost no travel happening, at least the second half of this program year, and the year that we're in right now as well. We're mainly talking about FY19 and moving some of that stuff that happened for the second half of that program year. But let's not forget that I've not traveled in a year now. So all of the travel that would have happened from September to now is still sitting on the books, so to speak, that needs to be addressed or accounted for. So I will second Elle's question about, hey, those of you that aren't going to have carryover who are able to, how do you manage that generally as well as this year and for the year that's coming up now?
This is Barb from Missouri, and one thing we're doing is every month we have a scheduled meeting where we look at our budget to see what's left in what category and can make sure that the invoices that we submitted through the process are being paid. So as everyone has said, travel has got a lot of money left in it. So we're identifying different trainings, as other people have mentioned, that hospitals need, are wanting and able to participate in. We're trying to get those trainings up and running, like a swing bed project. That is something that the state of Missouri did before I was in this role. And with the money that we identified not being used for travel, we're able to pick that up. So we're now going to go back to our swing bed program that we were supporting for our cause.
So Barbara, while we have you still unmuted, so you're having monthly meetings kind of within your office saying, hey, we've got $10,000 that we're foreseeing that we're not going to be able to spend on this. Can we reach out to our quality improvement contractor and say, hey, we've got some extra money, extra money in quotes, yeah. There's no such thing. Do you have additional bandwidth that, hey, we know we had you guys contracted to go out into the world or out into these hospitals to do some of this stuff? Can we shift that? Do you have the bandwidth for that? How do you have those conversations early enough that you're able to get that shift?
Yeah, and our meetings are more than just our office. It brings in our department's finance people, the people who know the processes by heart. You know, we have to research any new process to make sure we're doing it appropriately. So we bring them to the table and say, we're thinking about this process. Is it even doable in the state system? Is it, you know, consider the time frame and everything. So we bring them in at the beginning so they know what we want to do, which helps the process along because we know what barriers are going to be coming up and we can tackle that. And then we reach out to whoever we want to partner with. And if we have to talk to our project officer, we loop them in also. We don't leave them out till the very end after we get everything set up. But we start talking as early as possible. So we've actually, our swing bed program, we probably started those discussions in-house 2.5, 3 months ago. So, you know, we start everything as soon as we can.
Yeah, I like that. And I can't remember. Oh, the understanding, and even if you don't understand it personally within your office, understanding what constraints your state has, your office has in changing as well, getting contracts stood up with efforts that are not currently there. That is a huge benefit that will be very helpful when you're identifying carryover opportunities, be it another activity or just shifting it. As I would assume your state, just like the federal office, if you budget a certain amount of money to do something, they want it done. So if you're not going to fly to DC for the reverse site visit, they want to know what you're going to do with that as well from the state side. So understanding what that process is and seeing how it can be helped within the state and including those state partners in that is hugely beneficial.
I wanted to add something to that too. Just
Yeah, go ahead. We have at least one question in the chat box when
Oh,
when you're
okay.
done with this one, Benjamin.
Actually, I think exactly what was it, Catherine? I can't.
Yeah, Catherine. Yeah.
The 25%. That's why I was just about to talk about the 25%
perfect.
threshold. So it just so happened the question came out. Just for the recipients to know that you have that 25% threshold, 25% of your grant that you can move funds around within the approved categories. So if you're already approved for, of course, personnel, fringe benefits, travel, supplies, even if you have equipment is kind of sketchy, but even if you have equipment approved, if it's approved in your original budget, you can move that 25% around in order to still do long as you fall within the instructions of the notice of funding opportunity, and that you're working with your program officer to let them know what you're doing. You don't have to submit a prior approval request for that. That is in-house, that's internal, that you can move those funds. Like, for example, travel right now, if you need to move it for supplies or, what
This is Catherine. I appreciate that response, and I think I'll be fine within the 25%. However, is there any examples you can give us? What I'm confused about is moving. So you say moving, if we move more than 25% of our total award. So moving where? Between finance, travel, between the categories, or?
Correct, Kath. Yeah, correct. Within the category, if you look at your notice of your NOA, it'll show the categories that you originally approved for that budget period. As long as you stay within those categories and inform your program officer of what you're attempting to do, you should be fine. It's less than 25% that you're moving. So 25% of the total grant. The reason why we express that, because I know you can help me out here, Tori. I think what we have, is it 100,000 for a year for the grant?
No, these ones vary. So
They
it's
vary,
a
okay,
varying amount. Yeah.
we deal with, the GMS deals with grants that are, we can deal with a grant that's easily 2 million, 3 million, so 25% or up to 200. I think it was increased to 250,000, but up to 200,000. It does not have to be reported to, or should I say, requests go out to HRSA for prior approval. You can do it in-house as long as you document what you're doing and working with your program officer. Did that answer your question?
The question, Catherine?
I don't know if that answered your question as far as.
And I'll read while we're. I'll read your question. That way everyone has an opportunity if they didn't get the chat. When we develop the budget, is it okay if some numbers are a best guess at this point? For example, if we propose an HCAPS training initiative, but don't know for sure how many hospitals will participate, which should impact the budget, or if we don't have a particular quote from a contractor at the time we request in. So that discussion of kind of shifting some of that money is in response to that. Catherine, did you have another comment?
No, I think I'm pretty clear. I'm just obviously, as your Tori's advice was, to touch base with our project officer before turning it in. So yeah, I'll for sure do that to make sure I'm understanding it.
Awesome, thank you. And then another person that I asked to help participate is Sally, as we've at the center also work under a cooperative agreement with the federal office, and we too are not being able to travel. And Sally's been at the center for a few years now and has had some experience. So I just wanted to, as beneficial as it is to have Sally's experience, I thought we all could benefit from that. So Sally, I guess just kind of walk us through a little bit as the year, January, February of last year started happening and we're canceling travel, stuff like that. How do you guys, as those who look at the budgets and identify activities and things like that and manage those budgets for us, how does that start to shape up where you're starting to see that we're not traveling and we're not maybe going to be able to get all of those funds spent down? how do you start to identify additional activities that we can get done in that year to our last question about that 25% that we can just shift without having to have a carryover issue, and then moving on to that next year, as well as keeping in mind that we still only have the 5 or 6 people or 1 person in the office to do that task that we identified. So next year, when we pile on 7 more activities that we didn't get to this year, how are we going to get them done when we still only have the 4 or 5 people we have in our office to do them, or however many you have in your flex program?
I think planning ahead to avoid the unobligated balance or carryover is always best. And we do look at monthly kind of internal invoices as we request payment, but then quarterly our finance team sits down with Tracy and for myself, me with Ship, or we do that for the programs, and they project out for us like through August 30th. If we keep spending the way we have budgeted for personnel and for indirect, and we do all the activities planned, this is going to be the balance. So we kind of first look at, like, is there anything running above budget? Like maybe some years, yeah, when we were traveling, that might be running higher. Or are we expecting that reverse site visit, that's going to be higher? Like in this past year, no, we weren't traveling after March. We didn't have everyone come to DC for TASC advisory, or we weren't spending on speakers, but then we hired a group, Perform Media, to help us put on a professional multi, breakout session program. And so the funds, moved from travel to up to consultants for that Perform Media. And as Benjamin and Victoria were explaining, as long as it's within 25% of our total grant, those can flow and you don't have to change. So I think to avoid the carryover as much as you can, of looking ahead and making adjustments before the year ended. I think in this past year, so much was unknown and the hospitals weren't able to totally engage, even if you did plan new projects. So, and same with all of us working, our education is for all of you as flex coordinators. So we looked partway through the year of what project could we provide that was needed, that still fit in our goals for TA, and we worked with Ide Bailey to have the COVID funding guide developed and tracking. So sometimes you can, be looking, quickly to meet needs, but we're in the same boat. We're on the same timeline as all of you, that we're submitting our FFR coming up here the end of January. So even this morning, the task team was looking at following up on the discussion a couple of weeks ago of what are the needs of flex coordinators for this year, before August, that were maybe not completed last year that we can still do. And again, when we look at our carryover, it was primarily travel that, we did the activities we had planned, but okay, what else can we do to meet current needs? And kind of do a needs assessment, a little different than all of you, where you're serving hospitals or talking to your hospital advisory group. We use TASC advisory and talk to FORHP. We look at assessments that you've all turned in to us. And so our plan of action also is when we tend to look at projects, because those are things that you maybe do in the next 6 months that will not take travel, in this case, with the year, or, it's like not hiring, let's hire a person for, just for 6 months and to do this as, are there others within the center who can help in managing this project, or consultant, or additional guide to meet resource needs. But it is a balance of not putting so much out there that, as flex coordinators and tasks, that we spend a lot of time in trying to promote it and plan it and get the contract. And some of you, we're the same boat if, we have to put that out for an RFP, and that all takes time. So maybe looking at what can you augment? Like one of the ideas we had this morning was, the learning collaborative we had earlier in the year was really popular. Can we repeat that? Then we can amend a current agreement. We already have a lot of the communication built in.
Awesome, thank you, Sally. We had one question come in that also got answered, but Kayla was wondering if you could speak to how those of us with EMS supplement funds to differentiate our submission. I know we submit one as a request, but we could possibly need 2 budget tables and address activities separately. And then it should be one submission with a single budget table in the narrative section. You can differentiate the carryover amount for EMS supplement. So,
thank you for the question, Kayla. I just want to make it clear that because the EMS supplement is wrapped into the general flex funding for those 8 of you who are awarded that additional money for EMS work, we do need to see one single submission that addresses the full carryover amount for both the general flex and the EMS supplement, and you can differentiate that out in the narrative. And your project officer or Talia will be able to assist you.
Thank you, Tori. What other questions do we have for Sally, for Jen, for Marcy, anyone else, for Benjamin or Tori? We've got 7-8 minutes left. I want to make sure we provide opportunities for you guys to ask questions. All right, guys, not hearing any questions. I'll ask Andy to put up, we got a couple of reminders for you guys, as well as some exit polling questions. And I will reinforce that we at TASC are here for any questions you have, as well as your project officers and what do we call?
Grants
finance
management specialist.
There we go, yeah. Grants management specialists. Yeah, please do just let us know, or your project officer, what questions you have. We can help get those answered and help get to the person that can answer those questions for you. All right, Andy, you have polling questions up. And then there are a couple reminders that we'll make sure to remind you guys about. All right. A couple of webinars coming up, potential roles for rural ambulance services and COVID-19 vaccination. That's January 22nd from 2 to 3. All of these times are central. February TASC 90 is scheduled for February 17th from 2 to 3:30. Arquita MBQuip VKG for February is the 18th from 2 to 3:30. The reverse site visit will be virtual again. Those dates are the 20th through the 22nd of July. Let Andy know if you'd like to, or if you're interested in participating in the planning committee. And if you are interested in subject matter expert coaching calls following the November virtual knowledge group webinar focused on evaluation, evaluation performance improvement, please do let us know or email us at task@ruralcenter.org. And we have an upcoming learning collaborative focused on building and sustaining partnerships that you should be receiving an email notice about shortly. I want to open it up to any questions or comments that we have. We got about 5 minutes left. Please do let us know if you have any questions. not hearing any questions, I will thank Mr. White again for coming and helping clarify some of the processes. It's always a nice nice time to have you. We didn't get to see you at the reverse site visit this year, so good to see you again. Thanks for that, as well as Tori, Jen, Marcy, Sally, anyone else who I'm forgetting that I asked to speak who participated. Thank you very much. We really do appreciate it. All right, guys, we will see you. I think the next one is February 17th, as far as I can tell, for our upcoming webinars and meetings. We'll see you guys then. Otherwise, please don't hesitate to reach out at task@ruralcenter.org.
Thank
Thanks,
you.
guys.
See you guys.
Thank
Happy
you.
New Year.
Great information.
Thanks, Al.
Thank you. Thank you. Bye.
Guys, we'll talk to you later.